All right, here we have a mobile supine chest radiograph of a skeletally mature patient. And there are several features here that suggest the patient is unwell. To begin with, we can see vascular lines, cardiac monitoring leads, oxygen tubing, and an enteric feeding tube in place, which immediately gives us the clinical context of someone who is likely in intensive care. Focusing on the lines, I can identify a right internal jugular venous catheter, which is positioned satisfactorily at the brachiocephalic venous confluence. There's another vascular line on the left side, and this is where things start to look a bit unusual. If we trace the course of this line, it seems to be deviating medially, and its tip is projected over the aortic arch rather than within the expected venous structures. This immediately raises suspicion of inadvertent arterial cannulation, which is a serious complication. I also note the presence of an enteric tube, but the tip of this tube isn't visualized here, likely extending well below the diaphragm, which is quite typical in these cases. No pneumothorax is present, which is always important to check for, especially in patients with multiple lines and who may be on mechanical ventilation. The lung fields themselves look clear, and there's no obvious consolidation or pleural effusion. The heart borders are a bit difficult to assess due to the supine positioning and the presence of the various lines and tubes, but there's nothing overtly abnormal in the visible cardiac silhouette. Now, this particular case raises a few critical points that I'd want to discuss further with the clinicians. The main concern here is the potential arterial cannulation on the left side. This needs to be urgently confirmed, likely through blood gas analysis or ultrasound guidance. And if confirmed, it will need careful management. The removal of an arterial line, especially in a non-compressible site like the subclavian artery, carries significant risks, so interventional radiology input may be required to avoid catastrophic hemorrhage. This is a good case that highlights the importance of always scrutinizing the placement of lines and devices on chest radiographs, particularly in intensive care patients. Line misplacement is much more common in practice than one might expect, and it can lead to serious complications if not promptly identified. If this is making sense so far and you'd like more deep dives into cases like this, don't forget to subscribe to Radiology Made Easy. Drop your thoughts in the comments below, and let's continue making radiology more accessible, one case at a time.